and welcome to CRPS and Rheumatoid Diaries, or welcome back if you've been here before. In my last video, I was doing an information series, so to speak, on CRPS because so little is known about it that I just wanted to put the information out there, given it's something that I'm living with now. So this is part 2 of that. The other one got a little lengthy. I don't know if this one will or not. I hope it won't be quite as long. And I just came back from a CAT scan for my foot to find out what's happening with my bones, because the last x-ray I had showed that my bones aren't fusing after my fusion surgery, probably due to the CRPS. Yeah, that can happen, and it's been 6 months now, and you know, like you've heard in my other videos, I still can't walk. Like, I can't bear full weight on my foot at all because the bones aren't fusing, but also because of the CRPS. So anyway, I'm going to jump right into part 2 of CRPS information. I'm just putting my paperwork over there. And I am doing notes. I usually just wing it. I'm much better at winging it, so bear with me as I use notes because there is so much information. So I think I talked about stage 1 of CRPS the last time that I left off. So this is stage 2, which is between 3 and 6 months, during which time the symptoms progress. For me, I'm at the 6-month mark, so I'm closer to stage 3. But I don't know, I don't feel like my symptoms have progressed so much as changed. Different sensations have changed and whatnot. But it's different for everybody. Everybody responds differently, so this is just a very general outline. Skin continues to change and nails become brittle and crack. Like I've said in my other videos, my one toenail has stopped growing. The rest are fine. So there's that. The level of pain increases. I would say there's just as much pain, but different pain. Like sometimes I can even feel it shooting in my ankle and up my leg, and I don't like that because it worries me that there's spreads a high risk. So and the hair growth slows down. Yeah, on my one toe, a little bit of hair. Come on, you all know you do. It doesn't grow at all anymore. I don't have it, so I'm not complaining about that one. That's a benefit. Joints stiffen and muscles weaken. Now, for me, that's kind of hard to say because where the injury is, I've been fused. Like I have plates and screws in, so the whole point was for it not to move, after. So I mean, it hasn't spread to any other joints or whatnot yet, but or hopefully it won't, that I know of. But yeah, very painful to walk, and I can feel pain in spots where I didn't have it before in my arch of my foot and whatnot, spasms and that. So that's what is happening. So stage 3, if CRPS remains untreated to this point, which is basically where I'm at now, I'm past the 6-month mark, with no treatment, it becomes difficult or too painful to move the affected limb. Again, it's a limb that I can't move anyway, so I don't know. This causes the muscles and tendons to waste, atrophy, and a foot to contract. Now, I don't know if the spasms are my foot contracting or not. I don't think so, because it's not distorting. I just feel spasm. Contraction is when it distorts. Your foot kind of curls in, or your limb, whatever limb it is, or if it's your hand, it'll get stuck a certain way and you can't open it or close it. That sort of contraction. And with where mine is, I can't tell. So yeah, and these changes become permanent. So I don't know where I'm at. I'm gonna guess I'm permanent at this point, like 6 months in with no break. So the causes are unknown. it may be a disorder of the immune system, and I could see that because it acts a lot like autoimmune disease, and I also have autoimmune disease, so I wonder if it made me more prone to this happening. It affects the central nervous system, or CNS, producing inflammation of the nerves that control blood flow, sensation, and temperature. And it's my central nervous system, or anyone who has CRPS's central nervous system, misfiring. So you can imagine, I'm sure you could understand how it could spread anywhere at any time, because it's your central nervous system, and how any little thing can set it off or spread it. So one thing I will mention that I don't have in my notes is that apparently European people are more prone to it. Yay, I'm part German. I'm half German and half French, so there's the European, plus the autoimmune disease, plus many surgeries back to back, and other central nervous system stuff I had going on prior. So I think I was probably a waiting duck, or sitting duck. What is it? You guys know the term better than I do, apparently. So diagnosis. There are no specific tests. They will use the Budapest criteria, which is a list of common signs and symptoms of CRPS, developed by an international consensus panel. That kind of makes me giggle. Like, what's an international consensus panel? Just a bunch of people who got together and wrote down a bunch of symptoms from people? I don't know. Anyway, the Budapest criteria must report at least one symptom in all 4 of the following categories. Oh, you saw my notes. Sensory, oh my gosh, I can't say the word. It means hyperalgesia. There we go. Got it. Ding ding. It's early. I'm not a morning person. Hyperalgesia is where the pain, like if you were to get a cut, it would be way more painful for a person with CRPS than somebody without. Or allodynia, which is like, again, I've said it in my other videos, like the very slightest little touch is excruciating. And I really struggle with that on my foot a lot, like getting shoes on or leaving them on. I can't really. I wear a boot cast when I go out, and when I'm at home, I'm in a slipper, but I don't last long in that either. I can, however, tolerate a sock. I don't know why. I'll take it because cold. So anyway, the CRPS. So then there's vasomotor, where temp asymmetry. So I have that too, where my foot will freeze and look like I have frostbite, and nothing can get it warm, and cold temps make it worse, and ice would make it worse if you were to ice it. Like, it's just brutal, where the other foot is normal temperature. So that's temp asymmetry, and skin color changes or asymmetry, which I also get. Like I've mentioned in my other videos, my foot will swell up, turn beet red, and the other one just looks normal, and get really burning hot too, or it will get ice cold where the other one is just a normal temp. So there's that. I have that. Pseudomotor, or oedemia, which is like a fluid buildup. Like oedemia is a fluid buildup. You can get that from CRPS. Thankfully, so far, I don't have that, and I hope that I don't. There's sweating changes, or sweating asymmetry. It's hard to tell because I wear a sock, but I'm gonna guess that my CRPS foot is a little bit more sweaty than my other foot. So, because I kind of honestly feel that now. Like, it's weird. It's not something I've really noticed before, but it could be why my foot gets ice cold. I don't know. So, where are we at in time? Over 9 minutes. So, treatment. CRPS has no cure. Treatment is most effective when started early, but no guarantees. then either, because everyone responds differently. Some of the treatments help some of the people some of the time, some help none. It's just trial and error if you choose to go that route, which terrifies me. So they focus on relieving symptoms, slowing progression, helping with pain relief. Again, no guarantees with anything helping. And treatment, some of the treatments can cause spread. So, and the oral treatments are like side effects that just, in my humble opinion, it would just make it worse to have to deal with the CRPS and side effects of a medication, like serious side effects of a medication, to try and help it. So some non-invasive treatments usually come with, well, I just said bad side effects. I'm just reading my notes now. See, I do better winging this. Anyway, the prescription meds like steroids, which, as if you've seen any of my other videos, you know I will never touch steroids. And you can go back to my other videos to find out why. I don't want anything to do with them. So blood pressure meds, which before I got CRPS, I was on to deal with kidney issues, and it just lowered my blood pressure way too far, and I had to come off of them. Drugs that can help prevent or slow bone loss, that might be something I asked my doctor about, because I didn't know that existed till I did some research. Antidepressants. Well, for me, I have epilepsy, another neurological thing, and the antidepressants cause seizures for me, so I can't take them. Anticonvulsants. Well, I'm on one, which is in the Ativan family for my seizures, and it helps control it well. And I do notice that it helps a little bit at night, take the edge off the pain for me. But what they're meaning about anticonvulsants is like gabapentin, which I won't touch either with a 10-foot pole, in part because it's contraindicated. I can't talk today. It contraindicates other medication I'm on. It also causes extreme weight gain. No thank you. That'll just make me depressed. And Lyrica is another drug that they'll put people on. No thank you. They'll try physical or occupational therapy, but I hear from a lot of people that it just makes it worse, or it doesn't help at all. And I should do a disclaimer here. I should have done one in my last video, that I'm not a doctor. I'm not a medical anything. I'm just living with this and giving information that I've read and that I live with, just to protect my butt. So you got to choose what's best for you and what works for you in your own situation with it. A therapist to deal with depression and anxiety. Well, I've been seeing a therapist for many years already, so she has started to help me with this, but I think she first needs to learn more about it before she can help me with it. So invasive treatments, which they use, and again can cause spread. They can do a ganglion block. It's injected to treat the fight or flight nerves that can contribute to the swelling and pain. Sounds scary, huh? A spinal cord stimulator. A lot of people try a spinal cord stimulator. Again, you're messing with your spinal cord. It scares me. I'm not closed-minded to discussing any of that if a doctor were to discuss these with me, but they terrify me because I've already dealt with a spinal fluid leak that was horrific after a surgery. So I half wonder if that's what helped set this off, the CRPS. So I don't know, it scares me. And a lot of people find it either doesn't help much at all or not for long. Surgery that cuts the affected nerves and prevents painful impulses from reaching the brain, reserved for the most severe cases. Yeah, I don't know, makes me cringe. And then I hear and read a lot about ketamine infusions. There's also like a ketamine topical, like you can mix lidocaine with ketamine and try that. I don't know, that's one I might consider as a topical if the doctor would be willing. So as you can see, there's not a lot of hope with it, you know, and if you know me, you know I'm a hopeful person. So I'm just looking at my final notes here. Most in the medical world know little to nothing about CRPS. The pain is relentless. Walking really hurts, but sitting down, the pain, there's still a lot of pain. It's just a little bit different for me anyway. It doesn't stop. Like, it's 24/7, day and night, non-stop. So it becomes very exhausting and emotionally draining. It can spread to organs, which I think I've already mentioned. It's crippling and life-altering, which I've mentioned. I think I'm looking into, it's a combo of an electric wheelchair / walker, which really sucks at 53 years old. I feel like I'm getting old before my time, you know? The pain is extreme. And because so little is known about it, we can be seen as drug seekers and not believed. One of the reasons I'm glad that I got my diagnosis early and quickly, and that it's in my records, so that at least I can say, look, it's in my records, look it up, read about it, then tell me I'm drug seeking, right? Which I haven't been. I've been on one painkiller for years for my rheumatoid arthritis a day, and I've never gone over that except for after a surgery. I always come back to one pill a day, even with this extreme pain now. So yeah, that's it. That's all the info I've got, and I'm almost at 17 minutes. Whew. I didn't want to go that long, but it did. I hope it's helpful. Hopefully the next video I'll be able to talk more about what I'm dealing with now. I think I mentioned at the beginning of the video that I went for a CAT scan today, so hopefully next time I'll have the results of that to share. And I wish I could have remembered a video in the hospital. I'm just so stressed when I go to the hospital that I don't even think to pull out my phone and video. I got medical PTSD. So the other thing, I want to show you some amazing footwear that I've got that helps accommodate my fusion and foot situation. So until next time, there is hope. Hope is a good thing. Hit the like, what is it? I've gone blank. Like and subscribe button and the bell to be notified for further videos, and share about your own story in the comments. I want to hear about your stories. None of us wants to feel alone, and this is a lonely disease. So see you next time.